Good morning. It is my great honor to welcome you to the biannual Calderon Prize Award Ceremony. I'm Linda Freed, and I have the honor of serving as the dean of this great Mailman School of Public Health at a great medical center, and as the chair of the selection committee for today's awardees. And today it is my deep pleasure to be able to award the two most prominent public health awards in the field: the Frank A. Calderon Prize in Public Health and the Drs. Frank and Mary Calderon City Health Award. Administered by Columbia University's Mailman School of Public Health, these prizes were established to recognize, support, and thank our most eminent public health leadership. Importantly, we are deeply grateful and thank all of you for being part of this award ceremony today. It's been long anticipated, and I am so pleased to have so many friends, students, and faculty members and staff of Columbia Mailman and the Medical Center with us today, all of whom I know value the recognition of the most accomplished public health leaders. We are also so fortunate today to have several members of the Calderon family with us to help us celebrate and present these prestigious awards. Welcome to Francesca Calderon-Steichen and Joel Stammer, as well as, all the way from Paris, Ariana Calderon-Stammer and John Diaz. Today we come together because of the generosity and vision of the Calderon family, who have long understood the importance of elevating and recognizing our public health leaders. The Frank A. Calderon Prize in Public Health and the Drs. Frank and Mary Calderon City Health Award were established to celebrate our public health heroes who have dedicated their lives to furthering our collective well-being. And our collective well-being has never been more important to focus on. The prizes also honor Drs. Frank and Mary Calderon, themselves global and local public health leaders for New York City and for the world. The Frank A. Calderon Prize in Public Health, awarded biannually, is the most prestigious prize in public health. It recognizes an individual who has accomplished work of extraordinary distinction in the field of public health, making specific discoveries or contributions that have long-term, substantial, and significant national and global implications. The Global Selection Committee, itself comprised of leaders in public health and prior awardees, is mandated to nominate and choose a prominent public health leader with transformative impact to receive this award. We are grateful for the selection committee's commitment to the selection process and grateful that some of the selection committee members are here. The Drs. Frank and Mary Calderon City Health Award was established by Francesca Calderon-Steichen. This award of $15,000 is given to a not-for-profit, community-based organization here in New York City in one of the city's 5 boroughs, an organization that has demonstrated outstanding dedication to grassroots work in the field of public health. In addition to the Frank A. Calderon Prize and the City Health Award, the Calderon family generously supports our junior faculty's innovation through the Calderon Junior Faculty Awards. Awards are chosen based on the scientific merit of their research and its significance for public health. For recognition of excellence to research, I'd like to invite the awardees to stand so that we can recognize them. Dr. Sarah Casey, Dr. Please stay standing, Sarah. Dr. Allison Kopsko. Dr. Yuna Lee. Dr. Caleb Miles. And Dr. Stephanie Grillo. We are proud, really so proud of the work you are doing to advance the field of public health, our knowledge, and our solutions, and are grateful you're part of this wonderful community. Thank you. And I am so pleased today that we are joined by Dr. Ashwin Vasan, the Commissioner of the New York City Department of Health and Mental Hygiene, and a member of the Columbia Mailman and Medical Center community. Dr. Vasan serves on our board of advisors and as a jointly appointed faculty member in our own Department of Population and Family Health, as well as the Division of General Medicine within the Vagelos College of Physicians and Surgeons. Dr. Vasan is deeply committed to improving the health and welfare of marginalized communities through improved access to and engagement in quality public health and essential care and social services. Given his deep commitment to our city and our communities, it is fitting that he join me now to present the Calderon City Health Award. Dr. Vasan.
I don't. Linda was pointing out that I probably don't need the step stool, so I'll try to stay back a little bit. Thank you for having me. Thank you, Linda. Thank you. It's an honor to be here. I also just want to say it's an honor to be here with Tony Fauci. As someone who started his public health career 20 years ago working on global HIV, Dr. Fauci, your leadership, your decades of service, your consistency has been an inspiration to me and to generations of public health leaders. So I'd just like to give you a round of applause as well. Thank you so much to the Calderon family for recognizing the importance of public health professionals. Couldn't be more important. All of us have watched the sacrifices made by our public health heroes during the pandemic, especially here in New York City, which bore the brunt of the American pandemic early on. And today we take a moment to honor the commitment and dedication of some of these intrepid leaders. To select our honorees, we invited nominations from faculty and staff across the Columbia Mailman and Medical Center communities. 17 nonprofit organizations were nominated, all doing impressive work improving the health and well-being of the city's communities across the 5 boroughs. Our selection committee carefully reviewed them and took on the difficult task of narrowing the list to just 5 finalists, many of whom are joining us here today. So the privilege has fallen to me to introduce the recipient of the 2023 City Health Award, Nido de Esperanza. Since 2016, Nido has provided families in the Washington Heights community addressing maternal, child, and family health and well-being with community-centered, evidence-based approaches. Nido provides culturally appropriate and immigrant-sensitive programming to low-income families during pregnancy and the first 1,000 days of a child's life, which, as we all know, those first 1,000 days are so critical in setting up tens of thousands of days thereafter. All mothers in Nido's programs are assigned a social worker who meets with the family monthly to provide infant care necessities and services. Nido graduated its first cohort of mothers and babies in 2019 and has served over 160 families here in Washington Heights and in New York City. Nido has a strong relationship with the Columbia and the Mailman community and the Medical Center community. They've collaborated on several projects and grant applications focused on health equity and maternal morbidity and mortality, priorities shared by the New York City Health Department. And as a department, we look forward to learning more about Nido's work and exploring partnerships in the future. Nido's leadership in the community and their dedication to achieving greater health equity through collaboration and direct action are transformative. And I have to say, at a moment when public health is facing a crisis of trust, it is programs like NIDO, built on accompaniment, on relationships, on sustained engagement, that will be key to rebuilding trust between public health and the communities we serve. So I'm so pleased to present this City Health Award to the executive director, the co-executive director of NIDO, Giselle Pardo, and site director Astrid Cordero. Giselle and Astrid, I don't know where you are, but please join us to this, come to the stage and accept this well-deserved recognition.
I definitely need this step stool. So on behalf of Nido de Esperanza, I want to thank Dr. Kelly Stidman Hall for recognizing our work in the community and nominating us to the Millman School of Public Health and to the Calderon family. Nido is a small grassroots organization, but as we like to say, we're a small but mighty team, and is with partnerships with the School of Public Health, the Millman School of Public Health, through Columbia's Medical School, dental, nursing, and New York Presbyterian Hospital. These partnerships allow us to really reach many more families, giving them the health education, health resources that they need. Nido has a model that we're grounded in science but delivered with love. The science is clear that those first 1,000 days, that period starting in utero, is critical for the development of a child. We strive to deliver holistic care to families, babies and parents in the Washington Heights community, steeped deeply in the belief of community, hospitality, and hope. So again, thank you for this award, and we are so honored to be sharing this space with Dr. Fauci.
So thank you, Dr. Vassan, and congratulations again to Giselle, Nido, and all of your colleagues on the really profoundly important work that you're doing in the community and that is being recognized today with the City Health Award. We're grateful for your ongoing partnership and for the tremendous work you do for so many. I also want to recognize the 4 semifinalists for the City Health Award, all extraordinary organizations impacting the collective health of New York City. We Act, the African Services Committee, the Fresh Youth Initiative, and Housing Works. Before I invite Dr. Francesca Calderon to come up with Ariana Calderon-Stammer to share a few words, I do want to recognize that the partnership in this medical center between all 4 schools, the Vagelos College of Physicians and Surgeons, the School of Nursing and the College of Dental Medicine and the School of Public Health, is essential, both in partnership with our city and community organizations, with the health department, Dr. Vassan, and also, of course, in bringing health, the capabilities for health in partnership with everyone. And it's my particular privilege to have both Dr. Katrina Armstrong and Dr. Lee Goldman here with us today. As as physicians like myself and like Dr. Fauci, who understand that that public health and medicine are the two sides of the health coin, and that you cannot deliver the knowledge or the solutions for healthy communities without both sides of that coin. So thank you both for your leadership, and Dr. Fauci, who totally gets this. Thank you. So I would now like to invite Francesca Calderon and Ariana, if you're coming up, no, to join us. Thank you.
Yes, thank God. She said she left me a step stool, and what I said was, thank God. My name is Francesca Calderon Steichen. I'm Frank Calderon's daughter. I have been working with the Columbia School of Public Health, Mailman School of Public Health, since the prize began in 1987 when my dad died and I took over, and we awarded our first prize in 1992 to C. Everett Koop. And I was thinking this morning as I looked out on this group of Abigail Adams, who said to her husband one day, "Remember the ladies." And I said, as I walked up here, remember the mothers and the babies. Because we are here today, my part of this, to honor Dr. Anthony Fauci, but also a nonprofit that was founded in 2016 called Nido de Esperanza, which translates as Nest of Hope. And I was so delighted when Nido de Esperanza was selected by the recipient as the recipient of the second Dr. Frank and Mary Calderon City Health Award for their important work with immigrant infants and mothers. This finally gives me the chance to talk not just about my dad, but also about my extraordinary mother, Dr. Mary Steichen Calderon, whose very earliest passion, which you don't know, was mothers and babies. Mothers and babies. In the early 1930s, she created the very first picture book for babies using photographs instead of drawings. Working with my grandfather, artist and photographer Edward Steichen, she published the first and second picture book for babies, Everyday Things. Each image was specifically tailored by my mother, based on her own experience as a very young mother, to the things babies saw or used or wore every day. There was no text except a short preface explaining that mothers should let their babies explain the pictures to them in their own words. Today, these books are considered fine art. But at the time they were published, they were seen as a bonding and learning tool for mothers and their babies. Some years later, after completing her medical degree at the University of Rochester with a newly minted master's degree in public health from the Columbia School of Public Health, she was advised by New York City Health Commissioner Leona Baumgartner to do her field study on the Lower East Side under the tutelage of a brilliant young district health officer by the name of Dr. Frank Calderon. One of the programs they worked on together was the Mother's Health Organization. And you see, there's a thing to this. There's a pattern here. I'm coming to it slowly, but it's coming. This program, the Mother's Health Organization, which Mrs. Eleanor Roosevelt came to because my mother asked her to, trained young immigrant mothers to be health promotion leaders in order to improve the overall nutritional status of the district. My mother felt that only through mothers could this be accomplished. And I mention this only because it is not only germane to today's award, but was an important part of my mother's early life that not many people know about. Later in her career, some of you will know that she was far better known for her becoming the first female director of Planned Parenthood Federation of America, and then as the co-founder of SIECUS, the Sexuality Information and Education Council of the United States, a position she held until her retirement at the age of 80. I really needed to talk about my mother after 30 years. I hope you see this. I'm so sorry. So today, we honor Nido de Esperanza, whose intensive, supportive, and caring work with young mothers and their babies echoes the work my mother did in her 20s and 30s, work that is successful to family outcomes. Absolutely critical, and which my parents worked together to achieve on the Lower East Side with the Mother's Health Organization. Both my parents would be delighted by the awarding of the City Health Award to this grassroots organization. As the new grandmother of a lively 8-month-old, I am delighted too. And I have brought a copy of this book inscribed to Nido de Esperanza. And I would like you to know that it is considered fine arts, and you will see things in here that no longer exist, like clocks, but nevertheless, nevertheless, it is fine, it is wonderful, and I'm presenting this to somebody from Nido de Esperanza can come and get it from me. Thank you. Thank you very much.
I'm excited to talk to Dr. Fauci because he has a lot of experience in public health and medicine, and we talk a lot about them being two sides of the same coin, and I want to learn a little bit more about what he has seen in his lifetime, what he has done.
It's just an amazing opportunity that I just didn't really expect to come my way.
Hello.
Hi.
Come on in. Hi. Nice to see you.
Nice to see
You.
Yeah. Good to see you guys.
So, you're receiving the Calderon Prize. What was your reaction, when you learned that you were awarded this prize?
Well, I was thrilled, first of all, because of the importance and prestige of this award. And I have a long family history of Columbia. My father is a Columbia University graduate. My daughter is a Columbia University graduate, and my other daughter is a Columbia Teachers College graduate. So the idea of getting such a prestigious award from Columbia has extra special meaning for me.
You are a true New Yorker. I just wanted to know, growing up in New York and seeing how things have changed in your lifetime, what are some of the biggest changes that I guess you've seen in advancements in public health and medicine?
If you look at things such as the technological advances in medicine, as well as the tools that we use in public health, compared 54 years ago with what we have today, it's just been totally transforming. Exciting because it's allowed us to do so many things that when I was a medical student in 1962 through 1966, I would not have imagined in my wildest dreams the things that we were able to accomplish from so many aspects, from understanding pathogenesis of diseases to the development of countermeasures in the form of diagnostics, therapeutics, and vaccines.
So what do you think has been one of your proudest moments just in your career so far?
At the request of President George W. Bush, I became one of the principal architects of the President's Emergency Plan for AIDS Relief, or PEPFAR. And PEPFAR has wound up saving 25 million lives worldwide.
So how did your early reaction in your work with HIV/AIDS in the 1980s shape or shift your career?
Well, it completely transformed my career, even though at that time there were relatively few people who were infected. I just knew this was a new infection. It was sexually transmitted. We didn't know what it was. It didn't even have a name yet. So I totally changed the direction of my career and devoted everything, all of my time, clinically, research-wise, to studying this brand new mysterious disease, which we ultimately called AIDS. So that influenced everything else I've done since.
What are other public health concerns that you maybe stay up all night thinking about?
Well, I woke up to my worst nightmare in 2020. Continuing along the line of future nightmares, my concern has always been another respiratory illness. We've had now, within a period of 20 years, 3 outbreaks of a pandemic nature of a coronavirus. The risk of another coronavirus outbreak is there.
Why do you think we should be optimistic about the future of public health?
Well, we should be optimistic because we have a lot of bright young people who are interested in public health. And to me, that's the lifeblood of the discipline, is to get young, enthusiastic, passionate people who are excited about making a contribution to society through the arena of public health. I mean, the ability to do the kind of sequencing of pathogens within a day or less, and then getting those sequences and plugging them into a platform to make a vaccine that, as I mentioned with COVID, we did that within days. Within days. When I was in medical school 60 years ago, that would have been unimaginable. Public health is an extension of individual medicine. So individual medicine to a person, to a population, to a nation, to the globe. It goes from public health to global health. And it's really extension of each other. And global health cannot be global health unless you have individual health. So it really is, part of sort of like a total spectrum, and depends on where you want to lean one side versus the other. Some people get much more satisfaction of looking at the 40,000-foot global health picture. Other people feel much more gratification out of taking care of an individual patient that you actually put your hands on and help. I've been fortunate enough as I've done both. So I know what it is to spend hours with a patient, making them feel better, or, curing them if sometimes, which you do, versus developing the PEPFAR program, which saved 25 million lives. That was a broad 40,000-foot endeavor as opposed to individual patients.
What do you hope your legacy to be?
I want people to understand that I gave it everything I had right from the get-go. I never let down. And as they say in the sports, I left it all on the field. And if people remember me for that and forget all the specific things I did, that would be fine.
Thank you so much for your
You're
time.
welcome.
Thank you.
Very appreciative.
My pleasure.
Dr. Anthony Fauci, on behalf of Columbia University, the Columbia University Irving Medical Center, and the Mailman School of Public Health, and everyone in the room here today, thank you for leaving it all on the field. It is my honor to recognize and announce this year's recipient of the Frank A. Calderon Prize in Public Health, who absolutely needs no introduction. But I will do my best to do his illustrious 54-year career justice. Dr. Fauci served as a physician and scientist at NIAID at NIH for 50 years, and the director of the National Institute of Allergy and Infectious Disease for 38 of those years. In his role as director, he has been a key advisor to 7 presidents and their administrations on propelling HIV/AIDS treatment and prevention breakthroughs, to saving millions of lives through a vast array of initiatives to bolster medical and public health preparedness and counter pandemics based on science. Most recently, of course, COVID-19. In the face of the AIDS epidemic, when clinicians were scared to interact with patients, Tony, I know personally that you were at their bedsides. When rare diseases like Wegener's granulomatosis were incurable, you found a drug to treat it. You have trained multiple generations of great scientists and great physicians. And when the world found themselves, we found ourselves terrified of a respiratory illness called COVID-19, you provided steady, scientifically based guidance to all of us. And you have been consistently the leader we believed. Tony, your commitment to humanity is unparalleled and a model for all of us. You have saved countless lives, and to say you have had profound impact on the health and well-being of millions of people would be an understatement. I hope in this next stage of life, this highest prize in public health reminds you in the midst of what will be the next busy schedule, that you are deeply admired, even revered, that you offer a model of a great physician, a great scientist, a great leader for all of us. And we are deeply grateful for your service and your contributions to the public's health and to public health itself. Esteemed colleagues, friends, and students, please join me in welcoming Dr. Anthony S. Fauci to the stage.
Thank you. Thank you.
Okay. I'm the caboose.
Okay. Well, thank you so much, Linda and Francesca and Ariana. This is really such a wonderful and humbling honor to be here with you today to accept this most prestigious prize, the Frank A. Calderon Prize. As you can see from the title of my talk, I'm going to do something a little bit different. Being this is New York, the place of my birth, and my affection for this city, I'm going to title this talk, as you see, as A New Yorker's AIDS Journey Across 7 U.S. Presidents. Now, I'm going to get to the 7 U.S. presidents in a moment, but I could not help when I learned about the selection of this wonderful prize that I looked up a little bit about Frank A. Calderon. And to my great pleasure and amazement, I found out the extraordinary similarity and affinity between the Calderon family and my own. And I'm going to spend the first couple of minutes of this talk to tell you about that. So Frank Calderone was born in 1902 in Little Italy. 1 year before that, my grandparents on my father and mother's side, through Ellis Island, landed and lived in exactly that same neighborhood, maybe a couple of blocks away from where Frank Calderone was born. As in most Italian families and Italian-American families, they soon left Little Italy and moved to Brooklyn, first in the Bensonhurst section of Brooklyn, and then in Dyker Heights. And as you could see, that strong arrow that went from the Lower East Side of New York to the Bensonhurst and Dyker Heights section of Brooklyn. They stayed there. That was sort of like upward mobility, and some other people took the arrow out to Long Island. They never did that. They stayed in the Brooklyn section. And that's where I really grew up. And this is a picture of my father in front of the Fauci Pharmacy on 83rd Street and 13th Avenue in Dyker Heights. And you had heard on the film that my father actually went to Columbia College of Pharmacy. This is a picture of my father and mother who were in the pharmacy. It was actually a family pharmacy of which I got my first introduction to medicine and to health, because my father, as a pharmacist, was kind of the pro bono physician for the neighborhood. This is me and my Schwinn bike. So I show you my Schwinn bike because I used to deliver prescriptions from my father's drugstore to the different neighborhoods. And this was the earliest picture that I had of me. This is my confirmation. For if you're Catholic, you get confirmed. If you're Jewish, you get bar mitzvah. This was my confirmation. And then immediately after that, I went through the standard history of a boy who grew up in Brooklyn. I went to Our Lady of Guadalupe in Bensonhurst section of Brooklyn. And then I didn't go to Stuyvesant. Stuyvesant High School is where Frank went. And then he went then after that to Columbia and then to NYU Medical School. I went there to Regis High School, which was sort of like the Jesuit version of the Bronx High School of Science and Stuyvesant School. And from there, I went to the College of the Holy Cross. And interestingly, I was a classics and philosophy major with just enough science to get me into medical school. And I think that probably had a bit of an influence on how I look at patients and how I look at global health. I think that was a great influence because instead of studying a lot of chemistry and physics, I studied a lot of Greek and Latin, as shown by this particular slide. But then, as you know, I went into the field that I'm currently in now. I went to Cornell University Medical College. And from there, I did the usual course of taking, of taking several years of medical training in internal medicine at the New York Hospital Cornell Medical Center, now a sister organization to this medical center. You notice something unusual about this slide. It was all white and all male. That just goes to show you how old I was. There is a woman there, my good friend, Jackie Parthmore, who's up in the upper row, a couple from the left. But thank goodness things have changed since then. So what I did then is I went from New York to Bethesda, Maryland, to the NIH, as shown on this slide. And that's when I began to get interested in some of the things we're going to talk about right now. But it wasn't a straight line. It was kind of a course that was not linear. I went to the Laboratory of Clinical Investigation, and this is my mentor, Shelley Wolf. I show that because of the importance of the young students and others in the audience, of the importance of getting a good mentor who can advise you and really shepherd you through the process of the early stages of your career. Now, one of the things that I did early on, as Linda mentioned, was not necessarily jumping into studying infectious diseases, even though I was board certified in both internal medicine, infectious disease, and in allergy and clinical immunology. I was studying a group of diseases that were inflammatory vasculitides, one of them Wegener's granulomatosis, which is now referred to as granulomatosis with polyangiitis. And it was interesting because in the field of infectious disease, and I want to show you this next slide because it really is relevant, is that when I entered the field of infectious diseases, and this really has to do with AIDS, I'll get to that in a moment, is that the general feeling was that infectious diseases was a discipline of the past because we had vaccines and we have antibiotics, and we've essentially taken care of all the challenges of infectious diseases. And in fact, my good friend and one of my early mentors, Bob Petersdorf, wrote in the New England Journal of Medicine on the future of infectious diseases that even with my great personal loyalties to infectious diseases, I cannot conceive a need of 300 or more infectious disease experts unless they spend their time culturing each other. Well, Bob saw the light after that because what happened over the next few years is something that essentially changed how we look at emerging and re-emerging infectious diseases forever. And that is the onset of what turned out to be one of the greatest scourges in history. And these are the two iconic MMWRs, which announced the first few cases with pneumocystis pneumonia, 5 gay men from LA. And then a month later, another 26 young, curiously all gay men, not only from LA, but from San Francisco and New York, who presented not only with PCP, but also with Kaposi sarcoma and other opportunistic infections. This is the slide, and these are the two documents that literally changed my entire life. Because it was at that point that I made a decision I was going to change the direction of my career completely and devote everything I was doing to this young, mysterious disease that didn't have a name and didn't have an etiology. Now, before I go on to the story I want to tell you through the administration of 7 presidents, this was the beginning of our realization of the importance of emerging and re-emerging infectious diseases. And if you look at my tenure as director from the early 80s to today, this is what infectious disease emergences looks like and what I had to deal with. If you look at everything from hantavirus, flu, West Nile, SARS, all of the diseases that we had to do with. I'm going to put that aside for a moment because I want to talk to you about the subject of today's talk, is that HIV/AIDS. As you know, there have now through 2021, and that's just the latest of the official numbers, which obviously have gone up, there have been over 84 million cumulative HIV infections throughout 2021. The global statistics that come out every year, and these are the latest that come from UNAIDS, there are about 38 million people now living with HIV, over 1.5 million newly infected individuals, and over 650,000 deaths. And since the start of the pandemic, there have been over 40 million deaths. So this is certainly historically, and we are living through it even to this day, one of the most transforming pandemics in the history of our civilization. And we should not forget that. And that's the reason why I chose this subject for this New York audience, which, as you know, as you were mentioning, it was the epicenter of COVID in the early years. It was the epicenter of HIV together with San Francisco and LA. So now let's get to the 7 presidents that I had the privilege and the opportunity to advise in various degrees. And I'm going to go through each of them. I always get asked who your favorite president is. I'm never, ever going to say that. But I can tell you the reason I'm bringing this up is that my relationship with the president really was determined on a number of factors, including what happened to be the public health issue at hand during that presidency. You know, this is interesting. I always make that Freudian slip. Okay, so let's start off with Ronald Reagan. So I became director of NIAID during maybe the first couple of years of Ronald Reagan's presidency. Now, at that time, some of you may remember, there was public reticence and a lot of stigma associated with HIV/AIDS. And one of the things that President Reagan gets faulted for, and I think justifiably so, was his failure early on to use the bully pulpit of the presidency to address HIV/AIDS. However, there was much activity going on behind the scenes. We didn't know what the etiologic agent was, and yet we were probing to try and find out some hints as to what was going on. I show this slide, which is the first couple of New England Journal of Medicine papers that I published. Note that the first one on the left was before HIV was even identified. And we learned some interesting things about the aberrant B cell activation associated with HIV, which is the first hint that this was a virus that not only was immune suppressing, it was immune activating, which is the driving force of why virus replicates. And then we did studies on the qualitative analysis of the early immune defects. And then the breakthrough occurred, and that was in 1983, 1984, when Francois Barré-Sinoussi and Luc Montagnier first identified the virus, and then Bob Gallo the next year showed the connection definitively between HIV and AIDS. And these are the two classic papers. They're more than one paper, but the first observation by Francois Barré-Sinoussi in 1983, and then the series of papers by Bob Gallo and his colleagues definitively showing the connection. That's when things really started to move. However, during those early days, and I know I'm speaking to an audience and I see around even some friends who were experiencing it with me, they were really the dark days of my medical career, because this is just a picture of me and some of my fellows and students making rounds at the NIH Clinical Center. The frustrating nature of taking care of patients, all of whom are deteriorating before your very eyes, and you're putting Band-Aids on hemorrhages. You could treat opportunistic infections, but at the time, we did not have an effective antiretroviral drug. And what that led to was essentially grasping for straws. And as we all know, some of us remember the examples of some of the early experimental approaches to AIDS therapy, as it turned out, none of which worked. Some of these were very dramatic in how they unfolded. Some of you may remember when Rock Hudson was first found out to be infected, he went over to France, to Paris, to receive a drug that we didn't have available here, obviously a drug that was not effective. As all of this was going on in those early dark years, which I must say, quite frankly, I still have a bit of post-traumatic stress from that, because when you're a physician who's trained to heal people and everybody that you're taking care of was dying, this was seen very dramatically in New York City when the New England Journal of Medicine published that of the cases, the probability of death at 1 year was 51%. And the reason was, by the time a patient came to the attention of the healthcare providers, that patient already was likely infected for 6, 7, or 8 years. We didn't know that at the time. My career course changed when I decided one of the reasons that I did this was when the job of the NIAID director opened up, I did not want to get involved in science management or administration, because I'm at the core a physician and a scientist, but I felt that in order to call more attention to the HIV/AIDS pandemic, which I felt was not adequately being addressed, I did take that job. And as you can see, this is the NIH record in 1984. And that was the job that I was with until just 4 months ago for 38 years. That put me in a very interesting position of trying to do something about the resources associated with HIV/AIDS. And I began testifying before the Congress a fair amount. So This is a picture of me the first time I testified Congress asking for more money in 1985. Since then, it's a fact, look it up, I have testified before Congress more than any other person in history. And that is Elise. And if you do the math, I've been the director for 38 years. Every time there's a crisis, I get called before Congress 10, 12 times. Multiply the math and you get those number of times that I've testified before Congress. But one of the really important things that we did, we established the AIDS program to focus the attention on a number of then young, enthusiastic investigators to get involved in this brand new mysterious disease. And that was really the beginning of some of the solutions to get the best young minds involved in this. And here's some examples. At the NIH, when Sam Broder and Bob Yachuan and Mitch Masuyo, when they found out that a drug, AZT, which was an unsuccessful drug developed for cancer, happened to be inhibiting reverse transcriptase. And they used that in their in vitro assay, which led to the first and only placebo-controlled trial of a drug for HIV. And that was the now iconic study looking at AZT versus placebo in individuals with HIV infection. As you can see, the results were overwhelming with 19 deaths in the placebo and 1 with AZT. So that was back then. Now, getting back to the years of President Reagan, finally, in September of 1985, he mentioned publicly for the first time HIV/AIDS. That was in his second term. And that's what I refer to, again, not to throw any stones, but it would have been really helpful if we had the bully pulpit of the presidency talking about that. A lot of that was due to his good friend Elizabeth Taylor, because Elizabeth continued, yeah, you're right, clap for Elizabeth Taylor. Because what Elizabeth did is that she really coaxed him to make his first public appearance and to come out and say, this is a real problem. In fact, we even finally got him to come to the NIH. And this is a picture of President Reagan visiting us at NIH. And here's a picture of me finally getting the opportunity, one of many, of describing for him some of the things that we were doing with regard to drug development. And the president himself is on the very far left with his back to us, looking at my presentation about drug development. Now, one of the things that you cannot talk about that era without talking about the birth of AIDS activism. You know, starting right here in New York City, first with Gay Men's Health Crisis, and then with ACT UP New York, and then also in San Francisco with Marty Delaney and Project Inform. This was a very common sign in which it was the activist community, as I mentioned in so many interviews I had, who really got it right and tried to gain our attention to say they wanted to be part of the dialogue, of the planning, of the scientific and clinical agenda, as well as to point out the rigidity of the regulatory process in not allowing drugs to be made available on a compassionate use. And these are some of the things that some of you may remember. How they demonstrated here and shut down Wall Street in March of 1987. This is the late Larry Kramer, originally my nemesis, who turned out to be one of my close friends. One of the ways he wanted to call attention and to get me to appreciate that he was looking at what we were doing is that he wrote in a front page magazine section of the San Francisco Examiner, "I call you murderers, an open letter to an incompetent idiot, Dr. Anthony Fauci of the National Institute of Allergy and Infectious Diseases." He got my attention. But as I mentioned so often,
the point that they were trying to make were really very important point. And here's another example of protest at the FDA when I finally had the opportunity to put myself in their position and say, what would I have done if I were in their shoes? I would have done exactly what they did. And that's when we started to really make changes. And this is just an interesting New York Times article when I essentially went to the other side and I became an AIDS activist. And I began very openly pushing for the availability of drugs and things such as the parallel track, where you can actually make drugs available at the same time without interfering with the clinical trial process. You could make it available on compassionate use. That was the beginning of the concept of compassionate use. It really emanated out of HIV/AIDS, and I don't think very many people appreciated that. Okay, let's move on quickly now to George H.W. Bush. During that period of time of his presidency, we had funding growth. We had treatment progress. We increased the understanding of HIV pathogenesis, and the impact of AIDS activism was shown. I got to meet President George H.W. Bush when he was vice president, and during the time when he was considering running for president, it was very clear to him that he really wanted to learn a lot about HIV and AIDS. So we invited him to the NIH, and here he is on a visit to us at NIH. And that was one of the sort of the points that I make when I talk to people about Washington, D.C. You know, when in Washington, be nice to everybody. You never know where they're going to wind up. So I was very nice to the vice president, and guess what? He became president of the United States. And the next thing you knew, the funding of AIDS research dramatically increased, not only because of the Congress. It was a bipartisan approach. The Congress was very, very supportive. But George H.W. Bush was the first person as a leader who actually saw the need to actually embrace that and push that. Now, with the funding came the beginning of understanding pathogenesis. And these are some of the early papers appreciating that although many people who were first infected seemed to do clinically well, the clinically latent period, the virus was insidiously destroying their immune system. And these papers by Jeppy Pantaleo and I in my lab, as well as Ashley Haas and others, showed that there was no such a thing as latency, that the virus, unless you suppress it, is going to continue to destroy the immune system. And it was for that reason that we now have early therapy as early as you could possibly get it. That work was very much in partnership with work that came from one of your own. David Ho did a transforming work together with George Shaw, looking at the viral and the lymphocyte dynamics. It was those early studies that were really important. However, as the studies were going on, the patients were still getting sick and they were still dying. And this is another example. In August of 1989, we had reached AIDS cases at 100,000. And I showed you the numbers a little bit ago. This was very, very early on. And these were the things that we were faced with. And the activists, although we began and listened to them very carefully, we still had a lot to learn from them. And I kept continuing to reach out to try and find out how we could better partner with them. And this is a picture of me in the Gay and Lesbian Community Center down in Greenwich Village when in October 1989, I went down and was explaining to them some of the things that we were trying to do with the clinical trials. Now, it was very interesting, the relationship that we developed with them. At the same time that we had a rapport, they still said that they were going to wind up demonstrating against us because we didn't do enough. So it was such an interesting dynamic that you really cared about each other, you agreed, but they would say, you know, Tony, that's great, but we're still going to demonstrate. Now, many of you know the famous time when they stormed the NIH in 1990. I had dinner with them in Washington, D.C. the week before they did that. and they said, Tony, we love you, but we really still want very much to call attention to the fact that the government needs to do more. And this is a picture of Peter Staley, who was one of them, climbing up on the overhang of the building that I was at. Remember, 1 week after I had dinner with him in Washington, D.C. This whole dynamic with the activists was very well put in a film by David France called How to Survive a Plague. And that's a picture of Peter Staley back then, at the time he was getting arrested when he was storming the NIH. Fast forward about 30 years, and here's Peter and I right now at the Harvard Kennedy School and the Institute of Politics, reminiscing about the kinds of things that we went through back in the early years. Okay, moving on. The Clinton administration, a lot of very important things happened there. The first studies of ART to prevent mother-to-child transmission, the advent of combination ART, and as I'll get to in a moment, the development of the NIH Vaccine Research Center. The delineation of the replication cycle of HIV led to extraordinary insights into targeted antiretroviral drug, namely the protease inhibitors, the integrase inhibitors, and others. One of the first major breakthroughs was the reduction of the maternal-infant transmission by treating the mother during pregnancy and then treating the child immediately after birth. We've done much, much better than that now, but the first studies were those iconic studies that really transformed that whole issue of mother-to-child transmission. But importantly was over the years how things got better and better and better. And this is just a slide I show of the first AZT monotherapy when we brought the level of virus down, not way down to below detectable, and that was only transient. And then as the years went by with 2-drug therapy, we got it lower, but it still was transient. And then finally in 1996, when the triple drug therapy came along, which was led by the protease inhibitors then, we were able to do something we did not imagine we ever were able to do. And that is bring down the level of virus to below detectable and keep it below detectable. And some of you may remember those now iconic studies that appeared in the New England Journal and JAMA of the studies proving that triple combination of drug absolutely transformed the lives of persons with HIV. And everybody has examples of the famous Lazarus effect, where we went from an inpatient flooding the hospitals, hospices filled, to essentially people going back to work. And here's an example of a patient. This is a Haitian patient of Paul Farmer's, who actually, before we gave them a triple combination, and what happened literally just a year later. And with that, things turned around. With the introduction of HAART, the deaths in the United States dropped dramatically. But there was something else that happened during the Clinton administration that was really very interesting. In 1996, when the paper of the new co-receptor came out, President Clinton, he's, as you know, he's kind of a very wonky guy in wanting to know the details of the science. So he brought me to the White House, and here I am in the Oval Office explaining to him, he really wanted to know about that receptor. So I spent about 5 minutes telling about the co-receptor and how it binds, and he listened very, very carefully. And then as we were getting up, you know, when you go to the White House in the Oval Office, you walk out into the Rose Garden, and usually the press is there, and you say, well, I met with such, and we talked about such and such. So as we got up, and we're literally walking from here to there, he said, Tony, it's 1996, and you told me that HIV was discovered in 1983. Why don't we have a vaccine yet? And I figured, well, this was a great opportunity for me to maybe get some information in there. And I said, well, it's, you know, we have a truncated approach. Everything is siloed. We have immunologists and virologists, and people don't tend to work together. So smart guy that he is, he says, so what do you mean, like a center where you could bring people together? And I says, yeah, a vaccine research center. So as we were walking along, I said, we need a vaccine research center, and we need it at NIH. So he turned to Leon Panetta, who was his chief of staff, and he said, Leon, vaccine research center, can we do that? And Leon looked at him with a straight face and said, Mr. President, you're the president of the United States. we can do whatever you want to do. And actually, I thought he was just being nice to me. You know, okay, yeah, fine, we'll get a vaccine research center. However, 5 months later, I got a call saying that he was making a commencement address at Morgan State, and they decided they were going to build a vaccine research center. And they wanted some language. And this were his exact words from his commencement address. Today, I'm pleased to announce the NIH will establish a new AIDS vaccine research center dedicated to this crusade. And sure enough, the fastest building of a building on the NIH campus occurred, and we had the Vaccine Research Center. The reason I show you that is that although it was originally designed to study HIV, that's the very Vaccine Research Center that developed the COVID vaccine of Moderna that led to now saving millions of lives. So President Clinton's inspiration to do a vaccine research center for HIV almost inadvertently led to something that, even though we don't have a vaccine for HIV yet, it really was the fertile ground for the vaccine that we developed for COVID. It's interesting the way things work. Okay, moving on to George H.W. Bush. So there you go. So this was mentioned in one of the introductions. In the second year of George Bush's administration, when it became very, very clear that we were doing so well with HIV in the United States, essentially transforming the lives, he brought me into the Oval Office talking about a bunch of other things. And he said, you know, Tony, we as a rich nation have a moral obligation to help those who do not have access to HIV treatment and care because they lack the resources. So he sent me to Africa in April of 2002 to visit a few countries to determine the feasibility of and the accountability of being able to have a program to transform the lives of individuals who were in areas of the world that didn't have the resources that we had. This is a picture of me at a hospital in a Southern African country. And it was a very painful scene for me because it reminded me of 1981, 2, and 3, when I was making rounds on patients and they were dying because I didn't have any drugs because they didn't exist. This was a situation where the drugs existed, but they didn't have the resources for them. So the question was, if you gave them drugs, would they utilize them? So I went around the country. This was a young woman who took me through various villages in Southern Africa, in this case, Uganda. And here was her on her motorcycle, leading me, who was in a Jeep behind her, going into the bush. This was just literally in the middle of nowhere. And they were bringing drugs to people in villages who, some in the United States, probably either with subliminal or maybe overt racism, felt that people in Africa would not be able to take drugs if you got it for them, which was absolute nonsense because they were absolutely taking the drugs. So it became clear that this is something that we could do if we just gave them the resources. So, I went back to Washington and felt that one of the ways we could do this was use a very cheap drug, nevirapine, and give it to mothers and babies to prevent mother-to-child transmission, and a program of about $500 million. I presented it to the president, and the president liked it. However, one of the people who was very instrumental in all of this was his deputy chief of staff, who was Josh Bolton. And Josh allowed me to have pretty good access to President Bush. And although President Bush accepted the mother-to-child transmission, after I presented it to him, he said, and these were his exact words, I wrote it down when I went home. He said, Tony, the mother-to-child transmission initiative is a great start, but we need to do something on a much broader scope, something that is truly transforming. Work with Josh and put together for us something that is transforming and accountable. So I began working for months on trying to put together the architect for the program. But one of the things he asked me to do was impossible. He said, if we let people know about this, they're going to have 20 reasons not to do it. So you can't tell anybody. And I said, like, not even the director of NIH or the secretary of HHS? You can't tell anybody. But the rumor kind of got out that we were working on something, and I was surprised one day when Bono landed in Washington and came to my house and said, Tony, I'm hearing rumors. What are you up to? Something big must be going on. And I felt so badly because I really couldn't tell him what was going on. And he has become, subsequent to that, a very, very dear friend of mine. But the pushback against this, that it would cost so much money, is that OMB was very, very suspicious of me. So they said, we're not going to be, this is going to be something that's not going to happen unless you can show that, in fact, this is feasible. And they were a little bit derogatory about it. One of them said, you're a white guy in a suit and you're telling us what's going to do in Southern Africa. We've got to get people that really have been in the trenches there. So go bring some people to Washington to convince the OMB that this could be done. And by the way, you got to pay for their transportation. Okay. So I said, fine. I got on the phone and I mobilized some friends. So I called up Paul Farmer, who was in Haiti, Eric Gooseby, who was in Rwanda, Peter Magenyi, who was in Uganda, and Bill Pop, who was in Haiti, and said, you got to come to Washington and go to the OMB and explain to them that this is a worthwhile project that I have been pushing. So, but I'm not supposed to tell you what it's about. And we just got to have you go to OMB. And there's no way. It was a white lie. I lied to the President of the United States. I said that I wasn't going to really explain to them why. So we met in a restaurant in Bethesda, and I prepped them about what they needed to say to OMB. So I brought them to a quiet restaurant where we go to in Bethesda all the time. Now, the only thing about this restaurant is when I walked in, it reminded me of the scene from The Godfather when Michael Corleone just whacked the police captain and Siloso the Turk. But it wasn't. It worked out really, very well. We convinced them, and as it turned out, Mike Gerson, who some of you may know, the late Mike Gerson, who was a speechwriter for the president and then was a columnist for the Washington Post, helped me to put together the final words on the State of the Union address that the president announced in January 28, 2003, that they were going to invest, despite the chills that brought up down the spine of OMB, $15 billion to prevent 7 million infections, treat 2 million HIV-infected people, and care for 10 million people, including vulnerable orphans. Today, as you all know, the PEPFAR program is in 50 countries. The funding is greater than $110 billion. And as we mentioned, there's been 25 million lives saved, and there are about 21 million people on antiretroviral therapy and multiple millions of babies born free, showing you what the leadership of a president of the United States, the same way President Clinton led to the research that led to the drugs and the VRC, the Vaccine Research Center, President Bush played a major role in this. Okay, moving on. The Obama administration, the lifting of the travel and immigration ban, and then finally the culmination of what treatment can really do. Treatment as prevention, U equals U, pre-exposure prophylaxis comes of age. First thing he did was lift the ban on entry into the United States, a ridiculous ban that long needed to get lifted, and he did it. But also, during his administration, the proof that if you treat someone and bring the level of virus to below detectable, it makes it essentially impossible for that person to transmit the virus to anybody else. And pre-exposure prophylaxis really became very important. This was considered the breakthrough of the year by science, that you could actually treat someone and prevent infection in another, an entirely new concept. Pre-exposure prophylaxis became an extraordinarily important tool. However, we needed to do better. So during the Trump administration, the issue came of ending the HIV epidemic, an initiative which would actually, I wrote about in JAMA, how we can get the number of infections down by a dramatic percentage over time. The goal was 75% reduction in new infections by 5 years, 95% reduction in 10 years by diagnosing, treatment, preventing, and responding. Now, one thing I did leave out, and I left it out not because I wanted to essentially put it across to the side, but we have not yet been successful, because even though we've tried, we've had many relatively unsuccessful vaccine trials. I don't like to use the word unsuccessful or failure because we learned a lot from them, but the search for an HIV vaccine will continue to go on. And then finally, in the current administration of President Joe Biden, bolstering the effect to fight HIV at home and abroad, and augmenting the HIV treatment and prevention kits. What do we mean by that? Well, the president made a statement in December of 2021. It's a plan to make sure that the latest advances in HIV prevention, diagnosis, and treatment are available to everyone, regardless of age, race, gender identity, sexual orientation, disability, or other factors. In other words, focusing, as we continue the science, of the implementation of what we already have. In other words, to take the scientific advances and make sure that they are equitably distributed, not only internationally with PEPFAR, but also within our own country. And how do we do that? How do we make it easier? For example, if you look at the treatment gap, we still have 10 million people who are living with HIV who are not treated, who could benefit from treatment. And one of the ways we can do that is to take the rather prodigious medicine cabinet that we have and making it easier for people, like with long-acting ART or broadly neutralizing antibodies. What about PrEP? Can we do better with PrEP? There are 3 million people on PrEP. The global need for PrEP is at least tens of millions of people. How do we make PrEP easier? You do it again by long-acting injectables, which we now have. You can give an injection every 2 months, and likely we'll get it to every 6 months. And that's exactly what we hope to do. And finally, on the last slide, I want to leave you with this message that's really very important and really underscores everything that I've been talking about. Several years ago, I wrote an article in the New England Journal of Medicine. Ending the HIV epidemic will absolutely depend on following the science, not only in getting young people enthusiastic and excited about getting into the field, but also what we're all about here at Columbia Mailman School of Public Health is to make the science be the instrument for the distribution of the public health that I believe certainly is going to end the HIV epidemic. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.